AIDS is a disease caused by the HIV virus. It's called the immunodeficiency virus. It was first discovered in primates and it was then transmitted to humans. The virus, usual means of transmission is sexual transmission. AIDS is a disease which has a wide clinical range of presentation. It can range from an asymptomatic patient. Usually the first signs are a flu-like symptom, which is very inspecific, maybe some fever, some chills, and it can usually progress to something much worse. Usually the problem presents when patients are infected with another opportunistic disease, mainly when it's detected. If it's detected and the patient hasn't manifested any other symptoms or any other diseases associated with the HIV virus, patients can live up to 20 years with current drugs and current treatment. That's about the lifespan of a person with HIV once they're detected. But if the patient didn't know he had the disease and now has several infections or other diseases associated with HIV, prognosis can be very poor. It can be around, it can be, even weeks. The chief complaint that patients with HIV present also depends on the severity of the illness. Sometimes patients will present asymptomatic. It'll be detected by HIV can be detected by a test called ELISA, which is a rapid detection test. The patient must take at least 2 times the exam. It takes to suspect, so that we can suspect that the patient has the disease. After these 2 tests, they have to take another confirmatory test, which is a test called the Western blot, which confirms the diagnosis. It could be further studied with DNA testing of the virus, and to get a better idea of what type of virus it is. But at least you need the 2 ELISA tests and the confirmatory test, which is called a Western blot. The treatment is based on something called highly active antiretroviral therapy, which is abbreviated HARRT. It consists of at least 3 different drugs with 3 different mechanisms of action acting on the HIV virus. That is the base of therapy, and usually you also need to take prophylaxis for other opportunistic infections that present with HIV. Patients which present with an opportunistic infection and weren't taking any antiretroviral therapy will usually only receive treatment for the infection they have right now, and the antiretroviral therapy will be initiated later on. If the patient doesn't receive any treatment for HIV or the opportunistic infections that present along with it, the patient will have a very rapidly deteriorating course. They usually won't last more than 2 weeks. Usually patients will first, like I said, will receive treatment for the opportunistic infection which they presented with, and then they will usually start the antiretroviral therapy.